Okay, guys, moving on to chapter 6, we're going to talk about the skeletal system. So the skeletal system is our bones, right? So the human skeleton consists of 206 bones. It serves as the supporting framework, the supporting framework of our body. So think about a house, right? So we have to kind of build a structure of a house, and then we kind of add all the fun things to it, right? So that's what our skeleton is kind of that foundation and that structure that holds everything together. It helps to protect the vital internal organs that we have, right? So think of like your chest, your ribs, that type of thing. It helps to protect your heart and your liver and all that fun stuff. It plays an important role in movement because it attaches to the muscles, and it's a place for your muscles to attach, right? And it's a reservoir. So think of a reservoir, something that saves something for strong, for calcium, strong minerals like that. It stores those minerals in our bones. And then we have red bone marrow, which is where our blood cells are formed, right? So bones are classified according to shape. We have a long bone, a short bone, a flat bone, an irregular bone, and a sesamoid bone. So we're going to talk about those here. And then we have diaphysis. Sure. So that's a main shaft-like portion of a long bone. So it's a compact bone. And then we have an epiphysis. It's located at each end of a long bone. So think of like your femur, right? So you have that really long shaft of a bone, and then it has those ends of a bone. So like a classic depiction of a bone, right? And then we have the epiphyseal line. So that's a layer of cartilage. It separates those ends of each bone from that long shaft of a bone, and it allows the bone to grow lengthwise. And then we have the periosteum, which is the fibrous membrane, and that covers the surface of a long bone. And then we have the articular cartilage, which covers the joint surfaces. So then the inside of our bones, right, we have that marrow cavity, or the medullary cavity, which contains yellow bone marrow. And then we have the spongy bone, and it's also called cancellous bone, right? So there's like these little tiny holes, basically, that give added strength to the bone. I know that sounds kind of funny, but that's kind of what builds up that structure and strength of a bone. Red bone marrow is the site for blood cell production, right? And then our yellow marrow stores fat. So it's not an active site for blood cell formation in an adult, but it does store fat. Okay. So this is kind of the structure of a bone that we were talking about, right? So this is like that little cartilage area so that bones aren't rubbing one on another, okay? So then this is that red marrow. That's where our blood cells are made. And then we have that epiphyseal line. So that's kind of here, if you've ever heard the term growth plate, right? That's kind of where that goes. That's another term altogether, but it helps for the bone to kind of grow lengthwise. So think of like an itty bitty baby, their femur is going to be teeny tiny, right? But whenever we're a full grown adult, it's going to be pretty massive. And we have that spongy bone marrow here. Let's see. And then this is kind of that long shaft of the bone, the diaphysis. And then this is that distal epiphysis. Sure, so the end of the bone. So question, the bony skeleton serves many purposes except what? What does it not help with? I'm going to say C. Yep, so this is the function of the digestive system. So your bones do not help you digest. So bone formation, it begins before birth, right? So cartilage is gradually replaced by bone tissue as the skeleton develops. So you have to think about itty bitty babies, right? What did the first slide say? That we have like 206, I think, bones in our body. Babies are born with more bones because they're kind of pliable and they're not completely grown together. So we have these osteoblasts, which actively produce bone tissue, and then an osteoclast, which digests bone tissue. So osteocytes, these are mature bone cells, and they maintain the bone without producing any new bone tissue. And then ossification, this is the process of bone formation. So it helps to convert fibrous connective tissue and cartilage into bone or a bony substance. And then we have bone markings. So these are like specific features of different types of bones. So these are enlargements that extend out from a bone, maybe openings within a bone, a hollow region within a bone, the different points of attachment for muscles, points of joining one bone to another, and then any type of cavities and passages for nerves and blood vessels. So that has a lot to do with our spine, the bones in our spine. And again, when we're on campus, I'll show you guys that when we get to hang out with our friend Leon, the skeleton. So there's concave areas. So concave meaning something that's kind of dipped, right, for openings in a bone. So these help to form joints, and it serves as a point of attachment for muscles. And then we have a sulcus, which is a groove or depression in a bone. So an example of this is a fissure. So a fissure, so we're going to talk about the skull, right? So when we're born, our skulls have all these separate bones because they have to sometimes kind of collapse on each other to be able to make it through the birth canal, right? So if you've had a baby or you know a baby, they have that little soft spot. That's an opening, right? So as that baby grows, their soft spot is going to continue to grow and close. And your skull is full of these little fissures or little lines or grooves or depressions where bones are like grow into each other. And then we have a sinus. So this is an opening or hollow space in a bone. So if you, again, look at the skull, and it's just exactly what you guys are thinking, a sinus, right? So it's an empty space or a hollow space in your skull, right? So you have them kind of above your eyebrows, kind of around your nose. And then we have a fossa. So this is a hollow or shallow concave depression in a bone. So an example of this is like your hip bone. And again, I'll kind of show you. And if there's a picture on here, I can't remember for sure if there is or not. I'll kind of show you that too. And then we have a foramen, which is a hole within a bone for blood vessels or nerves to pass through. So think about your spinal cord, right? That kind of runs through those holes of your vertebrae, and then you have a hole or a foramen magnum of the skull where it connects to your brain. So there's a hole for those things to pass through. Okay, so question, what passes through the foramen magnum on the underside of the skull? What do you guys think? Neck muscles, the spinal cord, ball and socket joint, or your aorta? It's B. So the brain is connected by the medulla oblongata, my most favorite medical term ever, to the spinal cord, which passes through that opening. Good. So the cranium, which is their bony skull, it envelops or holds the brain, right? So it's composed of 8 different bones, and they're immovable once they kind of move or grow together. Again, whenever you're an itty bitty baby, they're kind of held together and they can kind of collapse on each other to be able to make it through the birth canal. But the borders meet to form immovable joints or sutures, okay? So this is kind of what I was talking about. So all these little lines here are those little sutures, right? So this is your styloid process. This is your auditory meatus, or like where your ears would be. This is your mandible or your jaw. This is the only movable joint in your head, right? This maxilla, which is your top jaw. You have your nasal bone, all kinds of fun bones in your head, right? Kind of make up that whole structure of your skull. And like this mastoid process of the temporal bone, that's this right here. That would be kind of right behind your ear. Then we have facial bones. So the 2 bones provide distinctive shape to the face. We have the upper and lower jaw. So that maxillae or that mandible, right? All facial bones are connected by immovable joints or sutures, except for the mandible. The mandible moves, so that helps in eating and chewing and talking and all of that. So that's that joint that kind of connects at your jaw line, right? And that's the only movable joint there. All right, so we have this frontal bone, which is like your forehead, right? Your nasal bone. So that's the only bone you have in your nose. The rest of it's all made out of cartilage. There's that top jaw and that lower jaw, right? That mandible that moves. Zygomatic bone, which is like your cheekbone, your temporal bone, which is right at your temple. Yeah, so there's all kinds of fun things in your skull. So true or false? The immovable joints in the skull and face are called fissures. What do you guys think? That's false. So it's a suture. Suture is the correct term for those joints. So vertebral bones, these form a long axis of the body. It's referred to as the spinal column or the backbone, right? So there's 24 vertebrae. We kind of talked about that in the last lecture. Your sacrum and your coccyx, and these offer protection to our spinal cord. We have our cervical vertebrae, so that's those ones that are really close to the head and neck, right? So if you break it down, cervic or cervico equals neck. And then we have our thoracic vertebrae. So that's the vertebrae of the chest. It's kind of makes up the longest form of that spinal cord. So that's identified as T1 through T12. So again, here, thorac or thoraco is equal to chest. That's what that means. And then we have our lumbar vertebrae. So this is the vertebrae of the lower back. So lumb or lumbo means lower back or loins. And that's identified as L1 through L5. So that's your lower back. And we have the sacrum, which is a singular triangular shaped bone. It is resulted from the fusion of 5 individual sacral bones in the child. Again, children are born with more bones than they have when they're adults, right? And then we have our coccyx, which is called the tailbone. So this resulted from the fusion of 4 individual coccygeal bones in a child. So that's your tailbone. Anybody ever bruised or broken their tailbone? That hurts like crazy. So true or false? The first 3 segments of the vertebral column are named by their corresponding body position. So the first 3 segments of the vertebral column are named by their corresponding body position. That's true. So cervic for neck, thorax or for chest, and lumb for loins. Good job. So then we have the bones of the thorax. So we have the true ribs. Again, when we're in class on campus, I will be helping you guys kind of identify these with our fun little skeleton friend, Leon. Okay. So true ribs, these are pairs. So there's 2 of them, 1 on each side, right? 1 through 7. So they attach to the sternum, which is your breastplate or your breastbone, right? So they attach to the sternum in front of the vertebrae, and the vertebrae in back. And then we have our false ribs, which are pairs 8 through 10. So they attach to the vertebrae in the back, but attach to cartilage of the 7th rib in front. So they don't attach to your sternum. And then you have floating ribs, which are pairs 11 through 12. So they attach to the vertebrae in the back, but they're completely free of attachment in the front. Then we have our sternum, which is our breastbone. So there's 3 parts to that, but that's kind of that big, massive bone right in the middle of your chest. And then you have your clavicle, which is your collarbone. So that connects laterally to your scapula and anteriorly to your sternum. Okay, so your clavicle, so it connects anteriorly to your sternum. So if we think about that term, right, it connects to the front of our sternum. Good. And your scapula is your shoulder blade. So this connects with the clavicle, which forms your shoulder. Then we have the humerus. So this is the long bone in your upper arm, right? So if you've ever said, somebody's ever said, oh, I hit my funny bone, right? That's their elbow. That's the bottom part of that long bone at the top part of your arm. And then you have your radius and ulna. So these are the two lower arm bones. Your radius is on the thumb side of your wrist, and your ulna is on the little finger side of your wrist. Then we have our carpals, so these are bones of the wrist. And we have metacarpals, so these are bones of the hand. And then we have phalanges. Anybody a Friends fan? My favorite is Regina Phalange, right? So these are bones of the fingers. So each finger has 3 bones, and the thumb has 2. Okay, so those are your phalanges. That's a fun word to say. So here's this is not Leon, but that's okay. Leon is in our classroom. So these are your cervical, here's your skull, right? Your cervical vertebrae, your clavicle, which connects to that sternum, your scapula, which is your shoulder blade, right? Your sternum right here. These are all those pairs of ribs, and you can see these ones that attach to the sternum, and then these that attach just to some cartilage, right? This is your humerus here, your radius and your ulna, your carpals, metacarpals, and your phalanges. It's a fun word, right? So that's kind of a little bit of a breakdown of what we've talked about so far. And then we have our pelvic bones. So I'm going to go back just a second. These are the pelvic bones that we're going to be talking about right here, okay? So this is your hip bone, right? So that's kind of that depression, that iliac crest is what it's called. So the ilium is the largest of the 3 hip bones, and it's the upper flared portion, or your hip bones, for lack of a better term. And then you have your iliac crest, which is the upper curved edge of the ilium. So it's a flat bone, but it's a good source of red bone marrow. So if you've ever watched Grey's Anatomy, when Izzy gives bone marrow for her biological daughter, right, they usually do an aspiration into that bone to collect that bone marrow, okay? And then we have this ischium, which is the lower part of the hip bones, and it's the strongest of those pelvic bones, okay? And then we have the symphysis pubis, which is this cartilaginous, it's cartilage, basically, joint at the connection of the 2 pubic bones. So I'm going to go back just a minute. It's this little piece right here. It's this little kind of bluish colored piece, that cartilage right there. So if you think about it, think about a woman that's getting ready to have a baby, right? This kind of all has to stretch, and that's what this does. That enables that stretching so the baby can be born. All right. And then we have this acetabulum, which is formed by segments of the ilium, the ischium, and the pubis. So the connecting points for the femur and the hip. Okay. So that's kind of this. This is that iliac crest right here. This is that iliac bone here. Here's that little symphysis pubis cartilage area. Okay. That ilium, the sacrum, right? Your coccyx, or your tailbone here. So that's a good little illustration there. Bones of the lower extremities. We have a femur, which is your thigh bone. This is the longest and strongest and heaviest bone in the body. The lesser trochanter serves as a site of muscle attachment, and the greater trochanter is an important landmark when selecting a IM injection in the ventrogluteal muscle, which is basically your butt, right? Which we don't practice at school, but if you are at a place where you give injections, they'll definitely teach you how to do that. And then we have the patella, which is our kneecap. And then we have a fib, or a tibia and fibula. So these are kind of like the lower bones in your arm. There's 2 of them in your leg too, which is your tibia and fibula. The tibia is the larger and stronger of the 2 lower leg bones, and it's known as your shin bone. And then we have the fibula, which is a more slender of the 2 leg bones. So if you've ever heard of the term, they have a fib break, right? That means they broke both of the bones in their lower leg. And then you have your ankle bones, or your tarsals, okay? And then the calcaneus, which is your heel bone, and then the talus bone. And then in your foot, it's kind of like your hands. You have your metatarsals and your phalanges. So those are the bones of the toes. And each toe has 3 of those little phalangeal bones, right? So each toe is made up of 3 of those little bones, except for the great toe or your big toe, which only has 2, kind of like your thumb. So question, instead of attaching to the sternum, false ribs connect to the cartilage of which numbered pair of ribs? Do you guys remember? So is it pair 7, pair 11? I'm not going to say pair 1 because pair 1's way up at the top. It definitely attaches to your sternum, or pair 9. What do you guys think? So it's A. So what was A? Pair 7. Cool. So the false ribs are numbered pairs 8, 9, and 10. I'm sorry. And these connect to the cartilage of the 7th pair of ribs instead of the sternum. The carpals are to the wrist as the blank are to the ankle. What do you guys think? It's tarsals. Good. So carpals are the bones of the wrist and tarsals are the bones of the ankle. And you guys will have an assignment to kind of go over all of this too. So, so pathological conditions when it comes to the skeletal system. Whenever we're looking at these, remember that whatever's in bold or capitalized, that's kind of what we lead with, right? So osteomyelitis, or, well, sorry, I said that wrong. So osteomalacia, right? So kind of what we pronounce or emphasize is the right word. That's the word I'm looking for. These are the kind of portion of that word that we emphasize. So this is defined as an abnormal softening of the bones due to a deficiency of calcium and phosphorus in the blood, which these are necessary for bones to mineralize, right? So this occurs in children, and it's known as rickets, osteomalacia. Okay, and then we have, here's what I was trying to say earlier, osteomyelitis. It's a localized or generalized infection of the bone and bone marrow. So this can be a result of bacterial infection that was spread to the bone tissue through the blood. So if somebody has an infection in the blood that kind of gets out of control, it can spread to all kinds of different body systems, right? And this is whenever it would spread it to a bone. We have osteoporosis. So this is a porous bone. So this is whenever bones that were once strong become fragile due to the loss of bone density, and they are at a greater susceptibility of fracturing, right? So they are a little bit more susceptible to breaking. So osteoporosis, you see it a lot in a lot of older people and mostly women. My class, like, I don't know, like 3 mods ago or something like that, they used to laugh at me because I said buffalo hump. It's a technical term, look it up. But this is, you know, at the age of 40, so this is my age, this is a normal spine, right? And then as this person ages 20 years, at 60, they start to kind of hump, right? So hump over. So if you have a mom or a grandma around these ages, right, you may notice that they start to kind of curve in their spine due to osteoporosis, or they'll say, I'm not growing, I'm shrinking, right? That's kind of the beginning, or this kind of the changes of osteoporosis in the spine. So true or false, osteoporosis and osteomalacia are describing the same problem, but one is more severe than the other. Is that true or false? That's false. So osteoporosis means the bone is still mineralized, but it's severely porous. So think of like a sponge, right? And then osteomalacia is the demineralization of the bone. So it takes those minerals out of the bone. And then we have osteochondroma, right? So this is the most common benign bone tumor. So thinking of benign, benign means not cancerous, okay? And this is most frequently involving the femur and the tibia. And then we have Paget's disease. This is a non-metabolic disease of the bone. It's also known as osteitis deformans, right? So it's characterized by excessive bone destruction and unorganized bone formation by the osteoblasts. So the bone is weak and pretty prone to fractures or like breaks easily. And then we have spinal stenosis. So the stenosis means like the hardening or narrowing of, right? So this is a narrowing of the vertebral canal, nerve root canals, or intervertebral foramina, which causes pressure on the nerve roots. So it may be congenital or due to spinal degeneration. And then we have Talipes Equinovarus. Okay, so this is clubfoot. This is when the foot is fixed in a plantar flexion, deviating medially. Okay, so this is, we're going to break that down. So the foot is kind of pushed down, right? It's flexed down, and then it is turned medially, so inward, with the heel in an elevated position. So I think there's a picture. Yeah. So that's a little clubfoot on a baby. And then we have abnormal curvatures of the spine. So we have this kyphosis. So this is an outward curvature, so a humpback or a hunchback. And then we have a lordosis, which is an inward curvature, so a sway back. And then scoliosis, which is a lateral or like a side winding or sideward curvature of the spine. So it may curve kind of to the right or to the left. So whenever you go to the pediatrics office with your kids and they kind of bend them over and look at their spine, that's what they're looking for, is to see if they have any curvature to their spine, which could be considered scoliosis. So this would be that kyphosis, right? Kind of that humpback. This is that sway back. And then this is considered scoliosis. It's the curvature of the spine here. So fractures, we have closed fractures. So this is a break in the bone, but it's not open, right? So it's not an open wound in the skin. It's a simple fracture. And then we have an open fracture, which is a break in the bone as well as a wound in the skin. Okay, so that's like if a bone breaks and comes through the skin, that's considered an open fracture or a compound fracture. And then we have a complete fracture, which is where the break extends through the entire thickness of the bone. Sometimes a simple fracture will just kind of break the bone or fracture the bone, right? But this is a complete, like it broke the bone in two, basically. And then we have an incomplete fracture, which is one side of the bone is broken and one side of the bone is bent considerably, but not broken. So a green stick fracture. So the best way to think about this is if you've ever, been outside kind of in the spring and like, playing around with your friends or whatever, and you grab a branch off of a tree and it's still green and you break it, it kind of splinters out, right? And doesn't break completely because it's still kind of malleable. It's kind of soft or I hate this word, kind of moist, right? So it kind of splinters out instead of breaking like a dry bone would, or not a dry bone, a dry stick. Sorry. I'm okay. Yeah. Anyway. So then we have a compression fracture. So this is caused by bone surfaces being forced against each other, right? So if somebody like jumps out of a treehouse and they put their hands out and to catch themselves and break their wrist, that could be a compression fracture. So that's where two bones kind of push against each other. And then we have an impacted fracture, which is direct force that causes a bone to break. So the forces it forces the broken end of a smaller bone into the broken end of a longer bone or a larger bone. And then we have this comminuted fracture, which is a splintered fracture. Okay, so this fracture, the break occurs at the lower end of the radius within 1 inch of connecting with the wrist bones. Okay, so the radius is on your thumb side, right? So it's at the that wrist bone that connects the radius to your wrist. And then we have a hairline fracture, which is a minor fracture in which the bone continues to be in perfect alignment, so it doesn't have to be reset. And it's also known as a stress fracture. A lot of people, like runners and stuff like that, get stress fractures in their feet. So it's just a little hairline, almost like a crack, right, in a bone. It doesn't make the bone move or anything like that, but it can be really painful. We have pathological fractures. So this is when a bone is weakened by a pre-existing disease like osteoporosis or something like that, right? So the break is in response to a force that would not cause a normal bone to break. So like you'll hear, if you work in family practice or things like that, you'll hear of, older women coming in and they're like, I just stepped off the curb wrong, or I fell off my shoe, and it breaks their ankle, right? More than likely it's because they have some sort of pre-existing bone condition going on, because if somebody, stepped off a curb wrong, they may maybe twist their ankle a little bit, but it wouldn't break, that type of thing. So treatment for fractures, we have a closed reduction and an open reduction. So think of what happens when somebody gets a fracture, they get a cast, right? So that's a sort of reduction that helps those to heal. So question, I jumped down from a ledge and heard a crack in my shin. X-rays showed that the broken ends of the bone were forced into each other. This is called what kind of fracture? What do you guys think? What do you guys think? So it's D. So that would be a impacted fracture, right? So when the broken ends of the bone are forced together, this fracture is known as impacted. So they impact each other. All right, so then we have diagnostic techniques, treatments, and procedures. So how do we find out what's going on with our bones, basically, is what this means. So we can have a bone scan. So usually you're given some sort of medium, some sort of like contrast, right? Either through an injection or through an IV or something like that. And that's absorbed into the bone tissue. And then you'll be scanned, right? So a scan of your skeleton after that kind of is absorbed into your bones will detect areas where the bone absorbs the isotope. So that might be lead to a conclusion or a diagnosis of like osteoporosis or something like that. So this is an anterior view. So this is the front of somebody, right? You can kind of see the structures of their face a little bit clearer than you can in this one. And then this is a posterior view. So this is the spine here. You can see the sternum here, the clavicle. So those are good little representations there. And then a bone marrow aspiration, kind of like I was talking about earlier. Sorry if you hear my dogs barking, I apologize. So bone marrow aspiration. So this is the removal of a small sample of bone marrow from a selected site with a needle. The specimen is examined under the microscope and it's used in a sterile technique. So if somebody needs a bone marrow transplant, this is kind of how they detect if that is going to be a match for somebody, or that's where they get that bone marrow from usually. Because that you have to remember that hip bone or that iliac bone is really dense in that red bone marrow. Non-invasive procedures for evaluating bone density. You can have a dual energy X-ray absorptiometry. Yeah, that's how you say it. This is most commonly used procedure. You can have a dual photon or a quantitative computed tomography. So these are just different types of X-rays. So true or false, the most common method to check for osteopenia or osteoporosis is the dual energy X-ray or the DEXA scan. What do you guys think? That is true. So DEXA is non-invasive, meaning you don't have to, cut anybody open or give them any sort of shot or anything like that, right? It takes less time and it emits less radiation than some available tests. Is that it? We're done? Okay, cool. All right, so there are different, I think 2 different assignments for chapter 6, which is the skeletal system. So you guys will need to complete that after you're done with this lecture. All right, talk to you guys in a little bit. Bye.